Tip drop when smiling. Patients usually describe that when they're smiling, which we do for most pictures, their nose looks even lower than it normally is. This happens for two main reasons. The first is the one you may have heard of. It's the depressor septi muscle, a little muscle that goes from the lip over to the base of the nose. For some, that muscle is more active and stronger. You may even see the nose moving when you're just talking. Certainly when you smile, the muscle activates and pulls the nose down. This can be addressed in two different ways. The first is the more basic. You can place a little bit of Botox into the muscle, release it, and if that muscle is also very strong and bringing the nose down, you may even get a tiny little bit of tip rotation. During surgery, we can either divide the muscle fully or weaken it. I actually personally prefer to just weaken it. The other reason for this tip drop is because of the face elevating. So it's not truly the nose that's dropping, the nose stays still, but when we smile, the cheeks and the lip all elevate upward. They take the nostrils with them, and the nose looks relatively lower to the rest of the face. This is harder to actually address because what we don't want to do is we don't want to paralyze our faces. You may see this on some patients with a little bit too much Botox where they smile really awkwardly to the side. So it is natural for the elevation of the entire face. However, one thing we can do is if we strengthen the columella, doesn't mean that we have to make it very pronounced, but if we just strengthen it, when we smile, the nostrils may still come up, but at least the lip won't curl in underneath and make the nose less stable and drop even more.